Hi, I'm Professor Roosevelt Mitchell III. Attention Deficit Hyperactivity Disorder, also known as ADHD, is one of the most common childhood disorders. The symptoms include a difficulty paying attention, controlling behavior, and hyperactivity. There are a wide range of drugs used to treat ADHD, stimulants and non-stimulants, but today we will discuss the most common Adderall, and I will be using the pill book, in which you can buy and purchase from your local bookstore or even Walmart, which is an illustrated guide to the most prescribed drugs in the United States. So using this book, we will discuss the cautions and warnings of Adderall, along with the common side effects and overdosage information. If your child is taking Adderall, the most disturbing caution and warning is that a large study suggests that children who take these medicines for ADHD have a higher risk of sudden death. Stimulants can cause weight loss and stunted growth in children under age 10. Blurred vision and difficulty focusing can occur. Possible side effects, the most common: loss of appetite, insomnia, restlessness, overstimulation, dizziness, increased blood pressure, rapid heartbeat, upper abdominal pain, and weight loss. In the overdosage, the symptoms include tremors, muscle spasms, restlessness, exaggerated reflexes, rapid breathing, dry mouth, constipation, hallucinations, confusion, panic, and over-aggressive behavior. That's interesting. You have your child on medication for hyperactivity, but it's a possibility that they can become over-aggressive with an accidental overdosage or any of the other symptoms. And those was just some of the warnings and common side effects, and the book also lists the least common side effects and the rare side effects also. But just think, you have your child on this medication for hyperactivity and attention deficit, but all of these other things can happen. And it's important as a parent to weigh all of these things out before deciding to place your child on this heavy medication, because it changes them. And I'm not advocating for you not to give your child medication if that's what they need, but I'm simply stating, please be aware of all the possible side effects just in case something is going on with your child that is abnormal, that doesn't typically happen, so you can possibly understand what it is and take he or she to the doctor or get it corrected fast. And if your child doesn't particularly need the medication per se, just do research and find other things or ask the doctor other ways to avoid the medication if they hadn't begun taking the medication. But if you have any questions, comments, or concerns, please leave them in the comment section below. And until next time, my friends, be blessed and be encouraged.